We are one of the strongest programs in neonatology in the country, both in terms of clinical expertise, in terms of research infrastructure. We train our fellows not just to do clinical medicine, but also to lead academic teams in neonatology. We want to train people who will write the next textbook of neonatology, not just read from the book. Our neonatology program is based in the University of Alabama at Birmingham, which is a regional level 4 perinatal center with more than 100 beds, and the Children's of Alabama with 48 neonatal ICU beds. So put together, we are one of the largest programs in the country.
We are the only level 4 NICU in the state of Alabama, so that means we see the most complex and sickest patients, which is a really great opportunity as a fellow to get to help manage those patients.
What excites me about this program is an excellent experience for fellows in both clinical and research as well as education.
As a fellow at UAB, we have the opportunity to pursue a master's in public health or a master's in clinical research.
I'm finishing up my first year of neonatology fellowship, and as far as our opportunities for autonomy here, our attendings are always available 24/7 in-house, but both at Children's and at UAB and the RNICU, we really are the first call for any issues that come up. So residents and nurse practitioners will come to us, and so we were able to come up with a plan and figure things out on our own, and then if we ever need backup, our attendings are available.
UAB is unique because we have very good outcomes, including among the lowest BPD and IVH rates in the US, as well as very high survival rates, including the most extremely preterm infants and sick term infants. UAB is also part of the global network that is focused on maternal and children's health research, and we have a full-time faculty member located in Zambia, as well as a team of researchers.
Fellows looking at UAB should know that we have all of the breadth of pathology and that they will have the experience, education, and support that they need here. They will be very well equipped to have jobs as neonatologists anywhere.
Conferences that we have include perinatal grand rounds, our weekly physiology conference, ultrasound lectures, radiology conference, a lot of different lectures that can help teach us about neonatology. And one of the really important things that we're able to get is protected time during our week to do that. So we're actually able to get our attendings to help cover the ICU in the meantime. And so all pages and calls go to them. And so we're able to focus completely on learning and not having to answer different questions on the unit.
Our attendings care a lot about our well-being. We, as fellows, are able to determine our own call schedule, which is very unique to our program, and we have a lot of autonomy when it comes to our clinical time, our research time, and our schedule.
Our neonatology program is a ACGME accredited program. We take 3 fellows per year, so we have a total of 9 fellows. Our fellowship program has been in existence since the mid-1970s, so we have trained more than 75 neonatologists who work at major academic centers around the country.
Most of our fellows join academic practices, and they have roles that are either mostly research or clinical, but there are some of the fellows that will go into private practice as well. They truly have any opportunity available to them.
I have been at UAB for 31 years now. I love Birmingham. The city of Birmingham is very exciting. There's a short commute, warm people, very nice working environment.
If you want to come to a program where you are going to see a wide variety of patients, get great clinical experience, get great procedural experience, and have a lot of autonomy as a fellow, but great supervision as well, I'd recommend coming to UAB. If you want a city to live in that has a great work-life balance and that's very affordable, I'd recommend looking at Birmingham. It's also a very beautiful city, so I definitely recommend coming and visiting.